Exercise during pregnancy, myths and guidelines. Pregnancy is often seen as a time when women must slow down and avoid physical activity. However, exercise during pregnancy is not only safe for most women, but it also offers a range of benefits for both the mother and the baby. Still, there are many myths and misconceptions surrounding exercise during pregnancy. Understanding the guidelines and separating fact from fiction is crucial for expecting mothers looking to stay active while ensuring their health and the health of their baby. The importance of exercise during pregnancy. Exercise during pregnancy can provide a number of benefits, including improved cardiovascular health. Regular exercise helps maintain a healthy heart, which is important during pregnancy as the body works harder to circulate blood and provide oxygen to both the mother and baby. Reduced pregnancy discomfort, improved posture, and reduced risk of gestational diabetes. Exercise helps strengthen the muscles, improving posture, and reducing the risk of gestational diabetes, a condition that can develop during pregnancy. Shorter labor and quicker recovery. Regular exercise can improve muscle tone, which can contribute to a more efficient labor process. It also helps the body recover more quickly post-delivery. However, it is essential to approach exercise during pregnancy with the right knowledge and care. Common myths about exercise during pregnancy. Despite the known benefits of staying active during pregnancy, many misconceptions still exist. Let's debunk some of the most common myths. Myth 1. You shouldn't exercise at all during pregnancy. This myth is far from the truth. In fact, most women can safely exercise during pregnancy, provided there are no complications. The key is to tailor the exercise routine to the individual's fitness level and health condition. Myth 2. Exercising will increase the risk of miscarriage. There is no evidence to support the claim that moderate exercise increases the risk of miscarriage. In fact, regular exercise can help reduce the risk of complications such as gestational diabetes and hypertension, both of which can lead to more severe outcomes. As long as the exercise is not excessively strenuous or high risk, such as contact sports, it should not affect the pregnancy negatively. Myth 3. You should avoid exercise if you're not already active before pregnancy. While it's always best to consult with a healthcare provider, many women who weren't previously active can still start exercising during pregnancy. Low-impact activities like walking or swimming are great options for beginners, as they improve overall health without placing unnecessary stress on the body. Myth 4. Pregnancy is a time for complete rest and relaxation. While rest is essential, complete inactivity is not necessary during pregnancy. Myth 5. You can't exercise if you're carrying multiples. While it's true that carrying twins or more may require additional caution, many women carrying multiples can still safely exercise with medical guidance. The intensity and type of exercise might need to be modified, but staying active with doctor approval is still often recommended for overall health and well-being. Guidelines for safe exercise during pregnancy. When it comes to exercising during pregnancy, there are certain guidelines to follow in order to ensure safety for both the mother and the baby. 1. Consult your doctor first. Before beginning or continuing any exercise routine during pregnancy, it's essential to consult with a healthcare provider, especially if you have any pre-existing conditions such as heart disease or diabetes, or complications such as preeclampsia or bleeding. Your doctor can provide specific recommendations based on your individual health. Focus on low-impact activities. Pregnancy causes changes in the body that can increase the risk of injury, such as loosening of the ligaments due to hormonal changes. Low-impact activities are the safest way to stay active without putting too much strain on the body. Some recommended low-impact exercises include walking. One of the easiest and most accessible exercises, walking is gentle on the joints and can be done throughout pregnancy. Swimming. Water supports the body, reducing stress on joints and ligaments. Swimming or water aerobics can also be an excellent workout for cardiovascular health and muscle tone. Stationary cycling. A safe option for maintaining cardiovascular fitness without the risk of falling. Stationary cycling is a great choice for pregnant women. Prenatal yoga or Pilates. These practices improve flexibility, strength, and relaxation, all while being gentle on the body. Prenatal classes specifically focus on modifications for pregnancy. Stay hydrated and avoid overheating. During pregnancy, it's crucial to stay well hydrated, especially when exercising. Dehydration can lead to complications, so make sure to drink plenty of water before, during, and after workouts. Also, avoid exercising in hot, humid environments to prevent overheating, as this can be harmful to both you and the baby. Listen to your body. As your body changes during pregnancy, it's important to adjust your workouts as needed. If you feel any discomfort, dizziness, shortness of breath, or other warning signs, such as vaginal bleeding or swelling of the legs and hands, stop exercising immediately and consult your doctor. Pregnancy is a time when your body might need more rest, so it's important to listen to those signals. Avoid high-risk activities. Certain activities are considered high risk during pregnancy and should be avoided. These include contact sports, e.g., soccer, basketball, due to the risk of injury. Hot yoga or exercises in saunas, which can increase body temperature and harm the baby. Lifting heavy weights or doing intense, high-impact exercise without proper supervision. 6. Aim for 150 minutes of moderate activity per week, according to the American College of Obstetricians and Gynecologists, ACOG. Pregnant women should aim for at least 150 minutes of moderate-intensity aerobic activity per week. This can be broken up into 30 minutes a day, 5 days a week. Regular exercise will keep your cardiovascular system strong and help you maintain energy levels throughout pregnancy. Benefits of exercise for expecting mothers. Aside from the obvious physical benefits, exercise during pregnancy can enhance emotional well-being, improve sleep, and increase stamina for labor. Here are some key benefits. Enhanced circulation. Regular movement improves blood flow, helping to reduce swelling and varicose veins. The role of exercise in postpartum recovery. While much of the focus is on the pregnancy period itself, it's important to also consider how exercise plays a crucial role in postpartum recovery. After childbirth, your body goes through significant physical and hormonal changes, and physical activity can aid in a faster recovery process. Postpartum exercise guidelines. Postpartum exercise should be approached with caution and patience. Women who had a vaginal delivery typically can start light exercises like walking as soon as they feel comfortable, often within a few days after delivery. For those who had a cesarean section, it may take a bit longer, usually about 6 to 8 weeks, before starting more intense exercises. Some helpful guidelines for postpartum exercise include: start slowly. Begin with gentle activities such as walking, stretching, or pelvic floor exercises. Strengthen core muscles. Pregnancy can lead to diastasis recti, separation of the abdominal muscles, and targeted exercises can help strengthen the core. Engaging in pelvic floor exercises, such as Kegels, can also aid in rebuilding pelvic strength and reducing the risk of urinary incontinence. Work with a healthcare provider. Before jumping back into a full workout routine, it's important to consult with your healthcare provider. They can assess your recovery and give recommendations on when it's safe to increase exercise intensity. The impact of exercise on mental health postpartum. Physical activity not only helps the body recover, but also plays a significant role in improving mental health after childbirth. Postpartum depression affects many women, and exercise has been shown to boost mood and alleviate symptoms of anxiety and depression. The endorphins released during exercise provide a natural, drug-free way to improve your emotional well-being. Adjust intensity when necessary. As pregnancy progresses, certain exercises that you could do earlier in your pregnancy may no longer feel comfortable. It's normal for the body to need more rest or to become fatigued more quickly, especially during the second and third trimesters. Modify your workouts to reduce intensity or focus more on flexibility and gentle movements. Exercises that might have been challenging before pregnancy may now feel too strenuous. So switch to low-impact movements like walking, swimming, or yoga. 2. Pay attention to your energy levels. Pregnancy often brings fluctuating energy levels. Some days you might feel energized and ready for a workout, while other days you may feel fatigued and need rest. It's important to honor your body's needs. On days when you're feeling drained, prioritize rest and opt for lighter exercises like stretching or gentle walks. 3. Avoid overexertion. Strenuous workouts that leave you feeling exhausted or winded should be avoided. Adjust as the pregnancy progresses. As your pregnancy progresses, you may need to modify certain movements or switch to different types of exercise. For instance, in later trimesters, you may feel more comfortable avoiding exercises that require you to lie on your back, as this can cause discomfort or reduced blood flow. Adjust your routine as needed and always consult with your healthcare provider if you have any concerns. Exercise and labor preparation. A common concern for expectant mothers is how exercise can help prepare them for labor. While there's no way to guarantee a smooth and quick delivery, certain types of exercise can be helpful in preparing the body for labor. Pelvic floor exercises, Kegels. Pelvic floor exercises, commonly known as Kegels, are one of the most beneficial exercises during pregnancy. These exercises involve contracting and relaxing the muscles of the pelvic floor, which support the bladder, uterus, and rectum. Regular Kegel exercises can also reduce the risk of pelvic organ prolapse and help in post-birth recovery. Prenatal yoga and stretching. Prenatal yoga focuses on improving flexibility, balance, and relaxation. It also incorporates breathing techniques that can be incredibly useful during labor. Deep breathing exercises help reduce stress, increase oxygen intake, and improve circulation. By reducing tension in the body, prenatal yoga prepares the pelvic area for labor and can improve overall stamina. Stretching can also alleviate tension in the lower back, hips, and legs, which are often common areas of discomfort during pregnancy. Strength training for stamina. Maintaining overall strength during pregnancy can also help you build the stamina needed for labor. A strong core and lower body can improve posture and balance, making it easier to maintain good positions during labor and delivery. Additionally, core strength helps with the pushing phase as well as in post-labor recovery. Exercise during pregnancy. The bottom line: exercising during pregnancy is not only safe, but highly beneficial for both mother and baby. Regular physical activity can help improve cardiovascular health, reduce discomfort, increase energy levels, and support emotional well-being. By following the guidelines for safe exercise and debunking common myths, expecting mothers can stay active throughout their pregnancy and recover more quickly post-delivery. However, it's crucial to always listen to your body and adjust your routine to match your energy levels, comfort, and the stage of pregnancy. Consult with your healthcare provider before beginning any exercise program, especially if you have any complications or concerns. By staying active in a safe and structured way, women can enjoy a healthier, more comfortable pregnancy and set themselves up for a smooth recovery after childbirth. Safe and effective exercises during pregnancy. Now that we've covered the myths and guidelines, let's dive deeper into safe and effective exercises that pregnant women can incorporate into their routines. These exercises not only help with overall health, but also enhance comfort throughout the pregnancy. Whether you're a seasoned fitness enthusiast or just getting started, these activities can work for women of all fitness levels. 1. Walking. Walking is one of the simplest and most accessible forms of exercise. It's low impact and can be done almost anywhere. It also helps to improve circulation and stamina, both of which are crucial for the growing demands of pregnancy. Start with 15 to 30 minutes per day and gradually increase as you feel comfortable. Walking not only helps strengthen the muscles of the lower body, but also improves cardiovascular fitness without putting stress on the joints. Swimming and water aerobics. The buoyancy of water provides support for your body, making swimming and water aerobics great choices for pregnant women. These exercises reduce the pressure on the joints, especially in the later stages of pregnancy, while still providing an effective full-body workout. Swimming can also improve cardiovascular fitness, and it's gentle on the body. Water aerobics, typically performed in shallow water, provides resistance to help strengthen muscles without the strain of land-based exercises. 3. Prenatal yoga. Prenatal yoga is specially designed for expecting mothers. It combines breathing exercises, gentle stretching, and strengthening poses to improve flexibility and reduce tension in the body. Regular practice can also promote relaxation and mental clarity. Yoga can be particularly beneficial in managing common pregnancy issues, such as lower back pain, swelling, and insomnia. Pelvic floor exercises, Kegels. Pelvic floor exercises, such as Kegels, are essential for strengthening the muscles that support the bladder, uterus, and rectum. These exercises help reduce the risk of incontinence both during and after pregnancy. To perform Kegels, simply contract and relax the muscles of the pelvic floor, as if trying to stop urination midstream. Aim to perform Kegels multiple times a day to maintain pelvic floor strength. These exercises not only aid in labor preparation, but also enhance post-birth recovery. 6. Resistance training, light weights or bands. If you were engaging in strength training before pregnancy, you can continue with modified resistance training throughout your pregnancy. Use light weights or resistance bands to target the arms, legs, and core. Focus on proper form and avoid heavy lifting that could cause strain. Mental and emotional benefits of exercise during pregnancy. In addition to physical health, exercise provides numerous mental and emotional benefits during pregnancy. Pregnancy can be an emotional roller coaster, and maintaining an exercise routine can be a powerful tool in managing mood swings, anxiety, and stress. 1. Stress relief. Exercise is a natural stress reliever. During physical activity, your body releases endorphins, the feel-good, hormones that promote relaxation and help manage stress. Stress levels during pregnancy can be high, especially if you're navigating major life changes, and exercise helps to manage those emotions in a healthy way. 2. Improved mood and reduced anxiety. Pregnancy can bring a mixture of emotions, from excitement to worries about the future. Exercise can be a powerful tool to combat anxiety and depression. Studies show that women who engage in regular physical activity during pregnancy are less likely to experience postpartum depression. Better sleep. Pregnancy can often disrupt sleep, especially in the later stages when physical discomforts and hormonal changes affect rest. Regular exercise, particularly in the earlier parts of the day, can help you sleep more soundly at night. It also combats insomnia by relaxing both the body and the mind. As long as you avoid intense activity right before bed, regular movement can promote deeper and more restful sleep. Enhanced body awareness. Regular exercise helps you stay connected to your body and maintain a sense of body awareness. As your body changes during pregnancy, staying active helps you stay in tune with your posture, balance, and movements. Activities like yoga or Pilates are especially beneficial in promoting body awareness, which can also reduce the risk of falls or accidents. Post-exercise care and recovery. Taking care of your body after exercising is just as important as the workout itself. Rest and recovery. Adequate rest is essential for recovery, particularly during pregnancy when your body is undergoing significant physical changes. Incorporate rest days into your weekly routine to allow muscles to recover and avoid overtraining. If you're feeling particularly fatigued, don't hesitate to take a break. It's essential to listen to your body and respect its need for rest. 3. Post-exercise nutrition. After exercise, focus on replenishing your energy stores with a balanced snack that includes carbohydrates, protein, and healthy fats. For example, a small serving of yogurt with fruit, a whole grain sandwich, or a protein smoothie can help repair muscles and restore energy levels. 4. Wear comfortable, supportive gear. Wearing the right gear during and after exercise is important for comfort and safety. Choose supportive sports bras, comfortable leggings, and proper footwear to avoid discomfort, particularly as your body changes. Invest in a well-fitting sports bra to M. Conclusion. Exercise during pregnancy is a wonderful way to maintain overall health, enhance mental well-being, and prepare for the physical demands of labor and postpartum recovery. By understanding the myths and guidelines surrounding exercise during pregnancy, expectant mothers can make informed choices about staying active throughout their pregnancy journey. Whether it's walking, swimming, or prenatal yoga, physical activity is beneficial for both the mother and the baby. Always consult your healthcare provider before starting any new exercise program, and modify your routine as needed to accommodate the changes in your body. Remember to stay hydrated, listen to your body, and enjoy the physical and emotional benefits of staying active during this transformative time. Staying motivated throughout pregnancy. One of the challenges women may face when it comes to exercising during pregnancy is staying motivated. Pregnancy can come with emotional and physical ups and downs, and some days it may be difficult to find the energy or desire to work out. Here are some tips to help expecting mothers stay motivated and consistent with their exercise routine. 1. Set realistic goals. Rather than aiming for intense, long workouts, set achievable and realistic goals that fit your lifestyle. If you're new to exercise, start with 10 to 15-minute sessions and gradually build up. Celebrate small wins, such as completing a weekly walk or finishing a prenatal yoga class. Setting attainable goals can make it easier to stay motivated and see progress without overwhelming yourself. Make exercise a social activity. Exercising with a friend, spouse, or attending a group class can make the process more enjoyable. Many communities offer prenatal fitness classes like walking groups, yoga, or aqua aerobics, where expectant mothers can connect with others and share their experiences. Exercising with someone else can make it feel less like a chore and more like an opportunity for socialization and support. 3. Focus on how you feel. Not just appearance. Pregnancy is a time when a woman's body undergoes numerous changes, and focusing solely on physical appearance or weight loss can create unnecessary stress. Instead, shift your focus to how you feel: more energized, less stressed, or experiencing fewer aches and pains. Recognizing the emotional and physical benefits of exercise, rather than focusing on weight loss, can be a powerful motivator. Find exercises you enjoy. The more you enjoy the activity, the more likely you are to stick with it. Whether it's dancing, yoga, or a gentle walk in the park, Finding exercise routines that you enjoy will make staying active feel less like a task. Enjoyable exercises also keep you mentally engaged and excited to work out regularly. Track your progress. Keep a fitness journal or use a fitness app to track your progress. Logging your workouts, how you feel, and any changes you notice will allow you to see improvements over time, which can be incredibly motivating. When you notice progress, it reinforces the benefits of staying active during pregnancy and makes it easier to keep going. Safety precautions while exercising during pregnancy. Exercising during pregnancy is safe for most women, but safety precautions must be followed to reduce the risk of injury and ensure the health of both mother and baby. Here are some important safety tips. Warm up and cool down. Proper warm-up and cool-down routines are essential before and after any exercise. Start with 5 to 10 minutes of gentle stretching or low-intensity cardio, like walking or cycling, to warm up your muscles and joints. This helps prevent injury and prepares your body for more strenuous exercise. Similarly, after exercise, cool down with light stretching or walking to help your body transition back to a resting state. Avoid lying on your back. As pregnancy progresses, it's generally recommended to avoid exercises that require you to lie flat on your back, especially after the first trimester. Lying on your back can compress the vena cava, a major vein that carries blood from the lower body back to the heart. This can lead to dizziness and reduced blood flow to the baby. Modify your exercises to stay upright or use props to keep the body at an angle that prevents compression. Be mindful of balance. As your belly grows, your center of gravity shifts, which can affect your balance. To prevent falls, avoid activities that involve sudden movements, jumping, or a risk of losing balance, such as hiking on uneven terrain or certain high-impact exercises. If you're unsure about an exercise or activity, always consult your doctor or trainer to see if it's safe for you. Monitor your body's signals. Always listen to your body's signals during exercise. If you feel dizzy, short of breath, or experience chest pain, vaginal bleeding, or severe swelling, stop the activity immediately and consult your healthcare provider. It's important to avoid pushing yourself too hard and respect your body's need for rest. Pregnancy can bring days of fatigue or discomfort, and it's okay to adjust your routine accordingly. Avoid overheating. Pregnant women are more prone to overheating, which can be harmful to both the mother and the baby. Be mindful of the temperature during exercise and avoid working out in hot, humid environments. Dress in light, breathable clothing and take regular breaks to stay cool. Drinking water frequently will also help prevent overheating and dehydration. Long-term benefits of exercising during pregnancy. While exercising during pregnancy offers immediate benefits, it also has long-term advantages for both the mother and the child, which can continue well after childbirth. Let's explore some of these long-term benefits. 1. Faster postpartum recovery. Regular physical activity during pregnancy can contribute to a quicker postpartum recovery. Women who exercise are typically in better shape physically, which can make it easier to recover from childbirth. A strong core and pelvic floor muscles can reduce the risk of back pain and improve the healing process. Reduced risk of chronic conditions. Exercising regularly during pregnancy helps lower the risk of developing chronic conditions, such as gestational diabetes, hypertension, and obesity. Maintaining a healthy weight through exercise reduces the risk of these conditions, which can have long-term health implications. It also promotes better heart health and metabolic function. Easier transition to postpartum fitness. Women who exercise during pregnancy often find it easier to return to fitness after giving birth. Their body is accustomed to regular movement, making it less challenging to get back into a post-birth workout routine. By staying active during pregnancy, women can build muscle strength, endurance, and flexibility that will make it easier to engage in more intense postpartum exercises. 1. Start slow. Your body has just gone through a significant event, so it's important to ease back into exercises. Start with gentle exercises such as walking, your pelvic floor exercises. Over time, you can slowly increase the intensity and duration of your workouts as your body heals. The focus on core and pelvic floor strength. First pregnancy, many women experience weakened core and pelvic floor muscles. Strengthening these areas should be a priority. Kegel exercises and gentle core exercises like pelvic tilts can help improve these muscle groups and restore stability. 3. Don't rush the process. Be patient with yourself and don't rush to lose the baby weight or push yourself too hard. Give your body the time it needs to recover and adjust to the demands of motherhood. The key to postpartum fitness is consistency, not intensity. Conclusion: empowering women through exercise during pregnancy. Exercise during pregnancy offers women numerous physical, mental, and emotional benefits, from reducing discomfort and boosting mood to preparing for labor and speeding up postpartum recovery. With the proper knowledge, safety precautions, and support, expecting mothers can enjoy the process of staying active while maintaining the health and well-being of both themselves and their babies. By debunking common myths and following the guidelines laid out in this script, women can embark on their pregnancy fitness journey confidently, knowing they are doing something beneficial for their health and their baby's development. Remember, each pregnancy is unique, so it's important to tailor your exercise routine to your individual needs and consult with your healthcare provider before beginning any new workout regimen.